Hello, everyone. I am Dr. How. Welcome to Find How to Know How. Yes, I am sharing with you how to treat and recover COVID long-haul symptoms effectively with Panem's acupuncture. Suppose you are an acupuncturist treating COVID long haulers but not getting consistent and substantial progress for some reason. This series of videos is for you. The protocol in this video has been applied to many internal organ disorders for years, such as the brain, lung, or breathing, and of course, the cranial nerve associate issues, like trigeminal neuralgia, Bell's palsy, and smell problems. We all know how closely some cranial nerves relate to smell and taste functions. Panem's is a system that can generate natural healing power on the cranial nerves by pressing the correct buttons in a particular sequence. This video and the rest videos in this series will demonstrate a step-by-step procedure that any acupuncturist can follow without difficulties. You can help people recover from the post-COVID adverse effects so much quicker as long as you follow the steps precisely. Based on many of our clinical successes, these protocols may be the most potential game-changer for the COVID long haulers out there. If you are a patient suffering from post-COVID effects, whether you didn't experience significant and satisfactory relief after treatment over time, or you just want to push your current medical condition to a better place, you have every reason to do so, and there is nothing wrong with that because I believe that no one should be living a life like that. Besides, you deserve one more chance to find out if this protocol works for you. What do you have to lose when the worst-case scenario is staying where you are? So, do yourself a favor by introducing this series of videos to your acupuncturist. This protocol could be a saver for the quality of your life. So, come right in with me. Hello, everyone. I am Dr. How. Welcome to Find How to Know How. There will be 5 videos in this COVID long-haul treatment series. We generate videos in such a sequence from parts 1 to 5 for medical reasons. First and foremost, when you don't smell and taste right, the chances are, you wouldn't have a good appetite. In traditional Chinese medicine, TCM, the spleen and stomach, aka the appetite, digestion, metabolism, and absorption in a general sense, are the acquired basis of the human body to stay functional. You need to eat and drink to stay alive. Therefore, restoring lost smell and taste can improve appetite and nutritional supplementation. Both are essential to the recovery from illnesses. In addition, nutrition is one of the sources of qi in TCM. So, re-establish the basis is our prime concern and the first step. In Part 2, we will cut straight into the management of heart and breathing problems. In TCM and the real world, the heart dominates the blood or circulation, and the lung dominates the qi or respiration. As an acupuncturist, you know how critical they are to a human's well-being. The lung carries qi, or respiration, oxygen, energy. The heart pumps out the blood that circulates throughout the entire body to nourish everything. So, fixing the heart and lung functions can boost the qi and blood spreading through the body. This is the second most crucial step. In Part 3, we will be talking about the treatment for kidney damage. The kidney is the congenital basis of the human body in TCM. On top of passing out wastewater, one of its functions is to help grasp the qi going downward smoothly to facilitate respiration and reinforce its distribution. This is why kidney damage takes third place. When your food intake, blood circulation, breathing, and congenital basis are back and functioning the way they should be, we will move on to Part 4. In Part 4, we carry on the treatment from the individual organs to the high-level commander, the brain and neurological issues. So yes, Panem's can exert the regulatory power on the brain and neurological activities by meridians and its points. Just so you know that before we finish editing this Part 1 video, one of Panem's alumni reported a successful case. A 30-year-old lady who had suffered from 1 to 2 seizure attacks every day since she was 14, had no episode, not even once, in a week after only 2 Panem's treatments. This is the latest exciting news about Panem's regulatory actions on brain and neurological functions. When the qi, blood, and nutritional supply chains are restored, some of the long-haul symptoms, such as fatigue, headache, brain fog, etc., may reduce or disappear. Finishing the first 3 parts also gives us an idea of how much percentage of the individual organ's long-haul symptoms are in the overall manifestations. What's left will be managed by using different approaches to resolve the remaining problems. And in Part 5, we will be targeting the autonomic dysfunctions. Yes, PONEMs can regulate not only brain functions but also autonomic nervous system activities to treat autonomic dysfunctions. By addressing the brain and autonomic nervous system, the central and peripheral nervous system, at the same time, we will expand acupuncture's capability to the maximal extent for resolving post-COVID long-haul symptoms. For this Part 1 video, we will be focusing on the treatment for the loss of smell and taste. Since PONEMs is quite different from the traditional acupuncture's mindsets, if you are new to PONEMs, we highly recommend you follow the steps and do what's been demonstrated precisely in order for you to see desired results. Here are the steps and details for treating patients with lost smell and taste. Step 1. Start the treatment with one side only, either the left or the right-hand side. For instance, the left or right side of the nose and taste. Doing both sides at this time would be too much and overwhelming, primarily for practitioners if you are new to PONEMs. Steps 2, 4, and 5. Always do the before, during, and after comparisons to have a clear idea of how the symptoms change along the course of treatment. Then, make an adjustment to the process according to the findings. Step 3, the treatment. It will be a step-by-step procedure to show you how to do it. For choosing a treatment side, here are the guidelines. The first guideline is to pick the side that is less worse than the other to begin with. It will grant you higher chances of getting good results even though a practitioner is new to PONEMs. Establishing some confidence in the beginning is always a good strategy. The second and the third guidelines come together. For a female patient, choose the right-hand side over the left. Pick the left-hand side first for a male patient. And of course, there are reasons behind this selection. But, it is somewhat complicated when it comes to choosing a treatment side in PONEMs. So, please just do it as told for the time being. There are 60 to 70% of chances that these are the cases. Okay, step 2, the pre-treatment test. You have to know where patients are right now before putting needles in, or you will lose the baseline information to compare to. Keep in mind that, either the loss of smell or taste or both, we highly recommend you use something with a very different and distinguishable smell and taste. It would be a lot easier for patients to tell the difference and how much it is. Let's say alcohol cotton balls or perfumes or anything of that sort would be the perfect selection to perform the test. And, of course, start smelling test with one nostril at a time to see how well or how bad the current condition is. It serves as the baseline for comparing any changes during and after treatment. It would be a good idea to use a scale of 0 to 10, with 10 being fully functional and 0 being no smell or taste at all. Then, see their current score on the scale before treatment, so both practitioners and patients can see the score sliding on the scale during and after the session. Testing the taste doesn't matter that much if we treat one or both sides because whatever you put in the mouth, it pretty much goes everywhere. Just make sure the patient rinses their mouths before tasting anything in an upright position to reduce the risk of choking. From this slide forward, we will be talking about the treatment. For the treatment of lost smell and taste, there are 4 groups of acupuncture point combinations. In this video, we use the patient's left side as our demonstration example. If for any reason that you treat the right-hand side, just flipped all the point locations from left to right and right to left. That's it. There are 4 points in the first group on the right hand close to the wrist and palm. They are on the lung meridian, and these 2 pictures show you where they are on the flesh and the bones. Please examine carefully for those points as their locations are not identical to the traditional acupuncture points. All the point locations and how to find them in this series will be demonstrated. Also, there will be footage to show you the sequence of needle insertion, and the tonification reduction methods. Take a look at the description of the PONEMs points. Point 1 is somewhere close to lung 7 but not exactly it. It is on the radial bone in the deepest depression formed by epiphysis and shaft of the radial bone. Point 2 is on the red-white skin immediately next to the first metacarpal bone. I repeat, immediately next to the bone, in the halfway. This point is close to lung 10 but not on the thenar muscle eminence. It is next to the bone in the gap between the thenar and the first metacarpal bone. Point 3 is next to the first metacarpal bone in the distal concavity formed by epiphysis and shaft. Another point next to the proximal concavity on the other end serves as a reference point. Point 4 it's pretty much identical to lung 9. It is in the wrist in a depression between radial bone and one of the carpal bones, the scaphoid. Now let's take a look at how to find them. For point 1, this is the epiphysis of the radial bone, and this is the shaft. The point is in the deepest depression formed by those two structures over here. If you slide a stylus or fingertips from the forearm towards the wrist, you'll be hitting a solid bony structure that stops you from moving further. Feel it carefully and look for the deepest depression in this area. That is the location of point 1. Let's go up a little bit and look for the point in the wrist, which is point 4. Again, it is in a depression in the wrist crease between the radial bone and one of the wrist bones, the scaphoid. You can feel it even with your fingertips, and it is so big that you can't miss it. Using a stylus would be easier for you to locate because the tip will naturally fall into a concavity or depression. There is one way to tell if you find that point correctly. After finding it, just leave the stylus gently into the depression and hold it in place slightly. Then move your wrist around in all different directions. If you hit the point precisely, the stylus will stay in place and not going anywhere. That's point 4. This video will be showing you points 2 and 3 together as they are close to each other. Make a loose fist with the thumb inside. This is the first metacarpal bone, and here are the two ends of it. When you slide the stylus from the wrist to fingertips along and next to the bone, you will be hitting a depression or concavity formed by the epiphysis and shaft on the far end. That's point 3. If you slide the stylus towards the wrist, you will be hitting another depression or concavity on the other end. That is a reference point for locating point 2. And in between the 2 points lies point 2 in the halfway. So from far to near, there go points 3, 2, and the reference point. Now we have the 4 points. The next would be the needling sequence. In Panems, the needling sequence means a lot in unblocking the blockage to relieve the pain or resolve the functional disorders. The same mindsets and skill sets apply to COVID long-haul treatment. Among those 4 points, tonification and reduction methods are essential to clinical success. But don't get it wrong. You cannot make things worse by messing up the tonification or reduction. The worst-case scenario in Panems treatment is no improvement and leaving patients' condition at where they were. So for those 4 points, we do perpendicular insertion for point 1 and the reduction method for points 2 to 4. We highly recommend applying tonification or reduction by tilting the needle tip to go along or against the meridian flow. That said, when the needle tip goes against the meridian flow, it is the reduction. With needle tips follow the direction of meridian flow, it is tonification. The main reason for recommending this reduction method is that the needle can generate constant reducing effects on the point at all times as patients lay on the treatment table. So, for point 1, the needle goes like this, perpendicular insertion. The red arrow indicates the meridian flow from the elbow to the fingertip. Points 2 to 4 are the reducing method. So the needle tips go against the direction of flow and toward the elbow. Starting with point 2, the needle goes in like this with a 6-degree inclination. Then the points 3 and point 4. If you remember that points 2 and 3 are next to the first metacarpal bone, it means the needles are like tangent lines that rest next to the bone. You might want to adjust the angle and needling depth to make them that way. The second group of acupuncture point combinations is in the right foot, and there are 4 points of them. 3 of them are identical to traditional acupuncture points, with only one exception: the one in between spleen 3 and spleen 4. And the point is called point CB in Panems. For acupuncturists, I believe all of you know how to find those points except for point CB. So, let me show you where they are, by using anatomical landmarks. Spleen 4 is in the foot on the spleen meridian in a depression or concavity formed by the epiphysis and shaft on the proximal end of the first metatarsal bone. And, of course, the same structure and landmark on the other end of the bone, spleen 3. The point in between spleen 3 and 4 in the middle is the point CB. There is no corresponding point in traditional acupuncture that matches this point. Spleen 5 is in a depression anterior and inferior to the highest point of the medial malleolus on the spleen meridian. Let me show you these 4 points in a video. This is the first metatarsal bone. And here are the 2 ends of it. If you slide the stylus backward, it will hit a concavity formed by epiphysis and shaft of the bone. This is spleen 4. Then slide it forward, it will hit another concavity formed by the same structures on the other end. That is spleen 3. Point CB is in between spleen 4 and spleen 3. Here is spleen 4, and here is spleen 3. Point CB is halfway in between over here. For spleen 5, the highest point of the medial malleolus, anterior and inferior to it in the deepest depression in the ankle. That's spleen 5. Again, the needling sequence is essential. There are perpendicular insertion and tonification as well. The red arrow indicates the direction of meridian flow. The needling sequence is spleen 4, point CB, spleen 3, and then spleen 5. For spleen 4, it is the perpendicular insertion, so the needle goes in like this. Then, for the rest of the points, use tonification. And so, the needle goes like this for point CB, a 6-degree inclination, and the same for spleen 3 and spleen 5. Allow me to remind you of one very critical fundamental of acupuncture treatment. You've got to make sure you have the arrival of qi, which is dai qi. Without the arrival of qi, you get slow or even no improvement in most cases. And there will be no therapeutic effect if you apply the tonification or reduction method to any needles without the arrival of qi. We cannot overemphasize the importance of this practical concept. It matters so much to the success of intractable cases, such as long-haul symptoms we are talking about in this video. The third group of the acupuncture point. There are only 2 points on the right hand. One of them is close to PC6, and the other is in between 2 palm bones. Let me show you where they are. For the one close to PC6, it is okay to locate it by sun or proportion. But keep in mind that the definition of an acupuncture point in Chinese is a cave, hole, or a den, so an acupuncture point is always in a depression or next to a concavity regardless of the landmark. PC6 is one excellent example. We will show you how to locate it later. The other point in the right hand is a point called CB in Panems. Like the one on the right foot, it is in between the 2 junctions of the second and the third metacarpal bones in the halfway. PC6 is too soon above the wrist crease. You may go from proportion first. Halfway of the forearm is 6. 1/3 is 2. So PC6 is somewhere around this area. It is just a rough idea of where PC6 is. We look for the depression. Sliding down towards the wrist. I find a depression in here in between tendons. Let me show you slowly so you can see the stylus tip moves up and down and how it falls in the depression. This is the depression I found. Going backward, it goes up. Forward, down. Up. Down. So, PC6 is here in this depression. These are the 2 knuckles of the second and third palm bones. Follow the gap between and slide backward until it falls into a depression between the 2 bones on the far end. Then slide between the 2 bones in the gap, going down further until you hit the other bone junction and fall into another depression on the other end. The point CB is halfway between the 2 depressions. The needling sequence and angle. The red arrow indicates the direction of the meridian flow. This time we do perpendicular insertion for PC6 and tonification. Repeat, tonification, not reduction, for point CB in the right palm. So, the needle for PC6 goes like this, perpendicular insertion. And the needle for point CB goes along the meridian flow by tilting the needle tip 6 degrees towards the fingertip. I would like to emphasize the importance of point CB in the right hand and another point CB in the left hand in the fourth group of points shown later in the video. These two CB points are the most crucial points that treat or even cure the lost smell and taste. Therefore, make sure you insert those two needles in the desired direction, which is tonification with the arrival of qi at all times. These two CB points hold up to 90% accountable for the success of the lost smell and taste. Okay, the last 2 points in the left hand. One of them is the heart 5, and the other is another point called CB in the left palm. Let's take a brief look at where the 2 points are, and how to find them. Heart 5 is on the pinky side, on the ulnar bone in a depression formed by the epiphysis and shaft of the bone. The point CB is between the 2 junctions of the 4th and the 5th metacarpal bones in the halfway. The following video will show you where they are, and how to find them. On the pinky side, there is a strong tendon. Find a depression on the inside of it and look for the depression between the epiphysis and shaft of the ulnar bone. So make sure you can find it accurately before moving on. Point CB in the left palm. The same landmarks as the CB point in the right hand. These are the 2 knuckles of the 4th and 5th palm bones. Follow the gap and slide backward until it falls into a depression between the 2 bones on the far end. Then slide down between the bones until you hit the other junction and depression on the other end. Point CB is in the gap halfway between the 2 bone junctions. The needling sequence. Start with heart 5 doing perpendicular insertion and do tonification on the point CB in the palm. So the needle goes like this for heart 5, and the needle for point CB goes along the meridian flow with needle tip tilting towards the fingertips. Again, as discussed earlier, 2 CB points in the right and left palm are the primary points responsible for generating therapeutic effects. But just because those 2 points account for up to 90% of the success does not mean the rest of the points are unimportant. All the points in this protocol are equally crucial to the success of lost smell and taste treatment. Those 2 CB points require the rest of the points to clear the way up ahead in order to generate desired results, and the other points need 2 CB points to pull the trigger and give the shot. Please keep in mind that all the points in any given Panem's protocol work together in a particular algorithm, combination, and needling sequence, and you won't have good results if any of them is messed or missing. Step 4. Verification and adjustment. After all the needles are inserted, especially those 2 CB points with a strong arrival of qi, some mild to moderate loss of smell and taste patients or short-term sufferers can immediately tell the difference. For the smelling, do precisely the same procedure as before the needle insertion and see if any noticeable difference happens. If yes, congratulations. If not, that's normal, too. Because everybody is different and some people just need more time to feel the changes. However, the acupuncturist needs to tweak a few needles to refresh the needling sensation again during the session. Those points are the 3 CB points in the right foot, right palm, and left palm. A slight up and down prick, flick, or twirl is enough to revive the needling sensation and sustain the therapeutic effects. You may re-test the patient with the same testing procedure again while they are on the treatment table. Repeat this testing and adjusting steps every 15 minutes until the session is over. For the taste testing, it would be safer when all the needles are removed and the patients are in an upright position to prevent them from choking on anything put in their mouths. With this protocol, the treatment outcome varies with the severity and longevity of the symptoms and the individual difference. Most people should feel the improvement in the first 1 to 3 sessions. After that, it is at the practitioner's and the patient's discretion how many visits are necessary to recover from the lost smell and taste. Here is my question for you: if you prescribe customized herbal formulas, take a look at the ingredients. Then, to whom would you give this formula? I raised this question because the Panem's-based herbal formula will be incorporated in the rest of the treatments for post-COVID effects to prolong and maintain the therapeutic power between sessions. I promise you that you will take home new yet effective Panem's acupuncture protocols and formulas that you have never seen or thought about for managing COVID long-haul symptoms. Okay, this is it. I hope you succeed with every patient that comes to you for help. More videos will be coming up for the rest of the long-haul symptom treatment. Please leave your comment below and let us know if you have any questions. Most importantly, your treatment results. I will see you in the next video.